Every tumor tells a story, but not every growth is cancer. Hello everyone, welcome to Pathology Unlocked. I am Dr. Aashna Goyal, and today we'll uncover the mystery of neoplasia. What is neoplasia? Neoplasia means new growth. New growth which is uncontrolled and is monoclonal proliferation of cells. It is of two types, benign and malignant. Like what happens in a normal cell? See, this is let's study the morphology of a normal cell. This is a cell. This is a normal cell. On the surface of normal cell, we have growth receptors. This is a growth receptor. When a growth factor from outside comes and attaches with the growth receptor, it acts as a stimulus. And this further causes mitosis and the cell division takes place. Basically, whenever stimulus is occurring, mitosis takes place. This growth factor attaches to growth receptor and further mitosis takes place. So, what is neoplasia? Definition of neoplasm according to Robbins: it is an abnormal mass of tissue, the growth which exceeds and is uncoordinated with that of normal tissue, persist in same excess manner even after cessation of stimulus. What is the stimulus? The growth factor, which evoked the response. So what happens in a neoplastic cell? We studied what happens in a normal cell. In case of neoplastic cell, this is a normal cell, and on the surface of normal cell are the growth receptors, but there is no stimulus. No growth factor is attaching, still mitosis takes place and the cell divides. This division takes place in the absence of growth factor, that is stimulus. No stimulus is required for mitosis. This further it converts into multiple cells mitosis, which takes place in the absence of stimulus. What are the components of tumor? Tumor usually have two components, parenchyma and stroma. Parenchyma usually comprises of the neoplastic cells and the remaining background, that is the supporting tissue and the blood vessels, as the stroma. Like see this, these are the neoplastic cells and this background is the stroma. This is a neoplastic cell, this is the parenchyma, and this all background is stroma. What is desmoplasia? When the stroma, production of abundant collagenous stroma by parenchyma is called desmoplasia. Abundant collagenous stroma. When the background is collagenous, we call it as desmoplasia. In what is there in a normal cell? A normal cell exhibits basal apical polarity and is uniform in shape and size. But in a neoplastic cell, there is loss of uniformity. Pleomorphism. Pleomorphism means there is no uniform shape or size of the cell. There is loss of tissue orientation and reversible changes. These all are together known as dysplasia. A neoplasm cell exhibit dysplasia. What are the grades of dysplasia? Mild, moderate, severe. Mild is usually the lower third of the cell. Moderate is the middle layers, and severe means when there is dysplasia in the entire thickness. Like see, if there is just dysplasia in this is mild, moderate and entire high. This is severe. See, these are the cells. There's dysplasia just in the above, lower, low and entire. This is known as dysplasia. What is carcinoma in situ? Carcinoma in situ, as the name suggests, there is dysplasia in the full thickness, but the carcinoma has not yet invaded to the basement membrane. The basement membrane is free of carcinoma. Invasive carcinoma. Invasive means there is penetration of carcinomic cells in the basement membrane. See, this, oh, just a second. Yes. This is carcinoma in situ. The carcinoma cells are just in the above the basement membrane is free of tumor. It is invasive. The tumor cells have invaded the basement membrane. Metastasis. Metastasis is spread of tumor cells. The spread is via blood or lymphatics and distant organ involvement is seen. The tumor cells spread to distant organs. What is the histopathic correlation? First of all, it is a normal cell. Then dysplasia occurs. Then it progresses to carcinoma, which is seen microscopically. What is the clinical importance? Clinical importance is it is very crucial for early detection and it prevents the malignant transformation. If we detect it at dysplasia state, it can be treated and it is reversible. Summary is it is the stepwise progression of neoplasia and importance of diagnosis and staging. Thank you everyone. Do like my channel Pathology Unlocked and wait for the next video, next part of neoplasia, that is the difference between benign and malignant.